All right, folks, second part of the lymphatic system. I think there's 8 or 9 of these little mini lectures, or maybe 6 or 7 or 7 or 8, something like that. This is the second one of a few. All right, so you got the overview, and you know that structurally the lymphatic system is called the lymphatic system, but functionally we call it the immune system. That was the video in the first lecture. You can see the still picture here of the anatomy. We don't cover this in lab. In fact, on the fetal pig, we look for the thymus gland. But uh, we don't cover the lymph nodes. And oh yeah, we do. We cover the tonsils. That's right. We cover tonsils in lab. But other than the tonsils, we don't cover much of the anatomy of the lymph system. I'm not sure why. I think mainly because we don't have models that have a great deal of those. But here are some lymph nodes. We do have some words I'd like you to know. Obviously, I don't want you to know all this anatomy. But when we have lymph nodes associated with different areas of the body, we we have some abbreviations for them. Like right here, you see MALT. And what that stands for is mucosa associated lymphoid tissue. We have GALT. That's gut associated lymphoid tissue. We have BALT. That is bronchiolar associated lymphoid tissue. And typically all of these are mucosa. So there's a mucosa lining your air passageways, that's the BALT. There's a mucosa lining your digestive tract, that's the gut associated lymphoid tissue. So they're all MALTs. They're all mucosa associated lymphoid tissue. However, we get more specific sometimes and we say BALT, meaning the air passageways, and GALT, meaning your digestive tract. So you're going to read that in your professional life at sometimes. Now you know what they're talking about. What happens is this. All of the white blood cells, well, in fact, all of the blood cells are made in your bone marrow, but the lymphocytes mature elsewhere. And for example, T lymphocytes mature in the thymus. B lymphocytes can actually mature in the bone marrow, but they may be maturing in other areas that we call bursa equivalent. And that's why we call them B lymphocytes. The reason for the misnomer is because we discovered a bursa in a chicken, and it's called the bursa of Fabricius, and that is indeed where the B lymphocytes mature in a chicken, is in the bursa. But we don't have a bursa. So we have what we call bursa equivalent, and we still name the lymphocytes B lymphocytes. Uh, One last thing about the anatomy of the lymph vessels and lymph nodes, is with cancers, they sometimes have to be removed. And because what happens is, if you have a cancer in a certain area of the body, and the lymph vessel and lymph nodes could be a seeding source for future tumors, when they excise the tumor, they will quite often strip out the lymph nodes and lymph vessels in that area as well. Now, having said that, remember what these lymph vessels do for us. We lose 3.6 liters of water per day out of our capillaries. Because remember how net filtration pressure overall favors filtration, even though we have albumin exerting an osmotic or oncotic pressure of reabsorption. Well, what happens with this 3.6 liters per day? It comes back into our blood vessels. But the lymph vessels are the conduits for bringing this fluid back. Well, what happens if this lady has right breast cancer and you remove that breast and they do a radical mastectomy, which means they remove all of these lymph vessels right here? Well, what that means is she now is not going to be very good at returning water from her right arm back to her blood. Well, this is not the end of the world, but what you do have to be careful of is you have to be careful of pressure on the right arm that could exacerbate losing fluid in the right arm, which means you can't take blood pressures in the right arm. You typically don't even draw blood in the right arm. Remember, you put a tourniquet on when you draw blood. So you're very careful with that arm now that you just strip the lymph vessels out of, because it's prone to edema. It's prone to edema because it doesn't have the fluid returning capacity that it once had when the lymph vessels were there. So I want you to keep that in mind in practice because that anatomy becomes pretty important. You can see here that the right lymphatic duct drains a smaller part of your body than the thoracic duct does. You can see that both ducts dump their lymph into the subclavian veins. So you can see that this is the right lymphatic duct right here, dumping its water into the subclavian vein. There's another duct they're not showing here. There's another duct over here, the thoracic duct, dumping its water into the subclavian vein. So this is where this is how the fluid returns to our bloodstream that we lose in our capillaries. Now you can see both ducts. You can see the right lymphatic duct right here dumping fluid back into the subclavian vein, and you can see the thoracic duct right there dumping fluid back into the subclavian vein. All right, so that's lymph drainage. The big thing about lymph vessels I want you to know is they have valves very similar to veins. There's a picture of a valve coming up here. So you can see the lymph vessels here are absorbing the 3.6 liters per day of fluid that you lost in your capillaries. It's absorbing that fluid right here. And now it's going to flow back and ultimately to your subclavian vein. And they do have valves. And is this showing you the valves? Not really. I think I have a picture showing you the valves. All right. So think of lymph vessels as similar to veins. That's what I need you to think of them as. This is showing you the valves. Here's a valve right here. It's a pretty cool way that they make these valves. It's really an overlap of the cells. The epithelial cells actually have an overlap, and that creates the valve. So the valve is slightly different than the valves you see in veins, but they function the same way. They prevent backflow of lymph. This is showing you that nerves are, well, actually the nerve is not there. I'm going to tell you that though, that what they should have shown you is another circular structure here, which is a nerve. Quite often when you do a section of a tissue, you'll see a nerve, artery, vein, and lymph vessel. You'll quite often see those together. And this is showing you the artery, vein, and lymph vessels seen together. And as I'm telling you right now, that quite often you'll see the nerve there too. So a lot of times when you slice tissue, like you see the slice right here, you'll see an artery cut, and you'll see a vein cut, and you'll see a lymph vessel cut, and you'll quite often see a nerve in there too. These four structures, and by the way, it could be more than one artery, or more than one vein, or more than one lymph vessel, or more than one nerve. But quite often you'll see those together when you cut tissue because they travel together. So that's the anatomy in a nutshell of how the lymph vessels return fluid back to your blood. Now this is showing you two pictures of clogging up your lymph drainage. This one's elephantiasis right here. It's a famous guy from Fiji, and he was treated. Some Western doctors saw him suffering from elephantiasis. This is his scrotal sac right here. He used to carry it around in a wheelbarrow. And I'm not joking here. I know I make jokes in lab and stuff, but this is true. He used to put his scrotal sac in a wheelbarrow and carry it around. What's happening is a worm, a parasitic worm, got into his lymph vessels and clogged it up so the fluid could not return to his body. So what happened was he got severe edema in his scrotal sac. These were some of the inguinal lymph vessels that were clogged up. With this lady over here, you can see that her upper body is certainly of normal size, but her lower body suffers from severe edema. This is called lymphedema. Some of her lymph vessels were clogged up by some parasites. This one is not elephantiasis. I believe this one is filariasis. It's the same etiology though, meaning that it's a parasitic worm clogging up the lymph vessels. And first of all, this edema in itself is bad. That's just first of all. And secondly, other things can now happen. See these creases between the edematous tissue, the edematous skin? Those creases quite often are conducive to fungal growth. So a person suffering from severe lymphedema like this, they'll get skin infections and fungal growths in these creases between the edematous skin, and that'll break down the skin, and they'll get decubitus ulcers. So she can get decubiti or decubitus ulcers, and that's not good. Of course, that leads to further infection. That can lead to death because it can lead to sepsis, infection, sepsis, and death. So these things certainly have to be treated. All right. Now, there's two branches of the immune system. There's a cell-mediated. Let me back up a little bit. There's actually two main branches of the immune system. There's the adaptive and the innate immunity. The adaptive and the innate. And what this is showing you here is that we have a population of lymphocytes called natural killer cells. You're born with these. These belong to innate immunity. But the rest of these cells, which are subclasses of lymphocytes over here, the T's and B's, these belong to adaptive or acquired immunity. Remember how some texts use adaptive and some texts use acquired. And we will go into details about what the B cells do. I'll tell you right now, they make antibodies. And we will go into details of what T cells do. Some of them are T cytotoxic and they directly kill things. Some of them help out. They're called T helpers. And some of them make sure we don't attack ourselves. Whoops, I should not have encased the memories. The ones that make sure that we don't attack ourselves are called T suppressors. And then we have memory cells. And these make us better at fighting future infections. And by the way, there's also B memory cells. It's not shown here, but we have B memory cells as well. So even in this branch of the immune system, we make B memory cells. T memory and B memory cells is the whole purpose for vaccination. That's why we vaccinate, to get these memory cells in our body, because the memory cells vigorously fight off subsequent infections. This is showing you that these cells are made in the bone marrow and mature elsewhere. So what happens is, for example, we have lymphoid stem cells made in the bone marrow. Now what they're going to do is when they get to the thymus or maybe some other lymph organ, because it's not always just the thymus, but the thymus is a major player. Matter of fact, there's athymic diseases where a baby's born with no thymus. They typically die a very young age of severe infections. I think an athymus, you'd have to look this up. I think DeGeorge's syndrome is an athymic disease. I'm pretty sure DeGeorge's. But whether that's true or not, because I'm not sure, my memory serves me well here, whether it's DeGeorge's or some other disease. Athymic diseases are horrible diseases, and the person usually dies young of some pretty innocuous infections that you and I fight off without even knowing we're infected. So this is pretty severe when you don't have a thymus. But the thymus is a place for lymphocyte production, maturation, especially T cells. Think thymus T. And B cells also can mature in bursa equivalent areas of your lymph. And some B cells mature right in the bone marrow, just so you know. So the bone marrow is the site of production of these cells. They may mature elsewhere, and they go out and they do their job. Like you can see a natural killer cell right here, killing an abnormal cell. What do I mean by abnormal cell? Well, a cancer cell maybe, or maybe a viral infected cell, something abnormal inside my body. Here is a B cell differentiating into a plasma cell, and it makes a whole bunch of antibodies. So you can see that. And these antibodies are going to go out and fight infection for us. And here's a T cytotoxic cell that kills an abnormal cell, similar to the natural killers. The difference here is this. This T cytotoxic never existed before until you got this abnormal cell floating around. Whereas what happens is our T cell adapted and clonally expanded and then attacked the normal cell, the abnormal cell. Whereas over here, the natural killer cells just floating around, surveying our body. That's why they call it immune surveillance. It's surveying our body, and anytime it sees a cell it doesn't like, kills it. So those are some cells of our immune system. This is some more anatomy of your lymph nodes and lymph vessels. These are actually lymph nodes here. You can see your tonsils. Typically, the one you actually call a tonsil is this palatine tonsil. This is the one you can see when you open your mouth and say, ah. You can't see this lingual tonsil and you can't see this pharyngeal tonsil, although they are there. But you can see this palatine tonsil when you open your mouth. Right here, they're showing you the palatine tonsils. Oh, by the way, the dotted line is the uvula. So realize that the dotted line is showing you the uvula. So that's there unless you've had it cut out. Now, when you have your adenoids removed, your tonsils removed, they might take out that uvula with it, and quite often do. They quite often do not leave that in there. Why? Well, look, it's in the way, first of all. They have to get to that pharyngeal tonsil to remove it. So they cut all of this out, including the uvula hanging down in the back of your throat. They cut it all out, and they'll take these out too. Okay, so those are your tonsils. This is the histology of a lymph node. I wouldn't spend too much time with this at all. I just will show you that you have afferent vessels coming in, so your fluid is coming in. It's being filtered and surveyed, and infections are fighting, and white blood cells are fighting off infections if you have them in your fluid. And then you have your efferent vessel, and the fluid now is on its way to the vein, and it's cleaner. If there were any bacteria or viruses or parasites in it, now they're not because your lymph node just killed them. So this is just showing you a lymph node. Don't spend too much time on the histology of lymph nodes. This is more about the histology of lymph nodes. The only time that you're going to really delve deep into the ultrastructure of these is if you become an oncology expert, because the lymphomas, of course, this is their breeding ground. So you will be talking about a lot about lymph nodes when you start talking about Hodgkin's lymphoma, non-Hodgkin's lymphoma, other lymphomas, some leukemias even. There is there is an overlap between some of the leukemias and the lymphomas. So that's when you'll become intimately familiar with the ultrastructure of lymph nodes. This is the thymus. It's one of your primary lymph glands. It does atrophy as you become an adult, but it's extremely important you have it as a baby, and you will see it on the fetal pig when you do that. It sits right on the epicardium. You can see it sitting right on the anterior side of the heart, and that's where you'll find out in the pig, in the fetal pig as well. If you're not careful, you'll actually rip it off the pericardium and might not see it. But if you're careful, you'll see it sitting right on the heart like that. The thymus gland is a site for T cell maturation. This is showing you the spleen. It's another major, right here's the spleen. Okay, so the spleen is on the left side and the liver is on the right side. How can this be? Oh, I know how it can be. You're looking from the feet upward. You must be. You have to be looking from the spleen upward, or for the feet upward, yeah. So this is, just so you know, when you look at this picture, it's confusing at first because it confused me at first too. The spleen is on your left-hand side, so this is left over here. And this is right over here. Your liver's on the right. So how can that be? And the answer is you're looking upward from the feet. That's how you're looking at it. You're not looking downward. Is that right? Yeah, that's correct. That's correct. Okay. So that's the spleen, and that's a primary lymph organ right there. And that's it. So that part of that particular area, that particular mini lecture, this one we just finished, I listen to it, but I wouldn't listen to it twice because there's not going to be any ultrastructure of lymph nodes on your tests. There's not going to be a lot of those things we just talked about. Basically, you got to know this. Lymph returns fluid to the bloodstream. The lymph vessels are valvular like veins, and they travel through lymph nodes, which cleans your fluid. That's basically what you got to know. See you in the next section.